The topic of circumcision is a complex and controversial one, with various perspectives and opinions. I can provide you with some information on the subject, but it's important to note that this is a general overview and individual experiences and beliefs may vary. Circumcision is the surgical removal of the foreskin, the skin that covers the tip of the penis. The practice has been performed for cultural, religious, and medical reasons in different parts of the world for thousands of years. Here are some potential benefits and considerations associated with circumcision. Hygiene. One of the commonly cited benefits of circumcision is improved hygiene. It is argued that removing the foreskin makes it easier to keep the penis clean, potentially reducing the risk of certain infections and conditions, such as urinary tract infections, UTIs, and balanitis, inflammation of the foreskin or glands, reduced risk of certain infections. Circumcision has been associated with a decreased risk of sexually transmitted infections, STIs, such as HIV, herpes, and human papillomavirus, HPV. However, it's important to note that practicing safe sex and using barrier methods, e.g., condoms, are far more effective in preventing STIs. Lower risk of penile problems. Circumcision has been linked to a lower incidence of conditions like phimosis, a condition where the foreskin is too tight and cannot be retracted, and paraphimosis, a condition where the retracted foreskin cannot be returned to its original position. However, these conditions are relatively rare and can often be treated without circumcision. Social and cultural factors. Circumcision may be performed for cultural, religious, or social reasons. For individuals belonging to certain cultural or religious groups, circumcision may hold significant social or religious importance. On the other hand, there are also arguments against routine circumcision. Personal autonomy. Some argue that individuals should have the right to make decisions about their own bodies and that circumcision should be a personal choice made in adulthood, rather than an imposed procedure performed on infants or young children. Pain and risks. Like any surgical procedure, circumcision carries risks such as bleeding, infection, and adverse reactions to anesthesia. Some individuals also experience pain during and after the procedure. Sexual function and sensitivity. The foreskin contains sensitive nerve endings, and some opponents of circumcision argue that removing it may reduce sexual sensitivity or pleasure. However, scientific studies have produced mixed results on this matter, with some studies suggesting no significant difference and others reporting minor differences in sexual sensation. It's important to note that the medical community has differing opinions on the benefits and risks of circumcision. Some medical organizations, such as the American Academy of Pediatrics, suggest that the decision should be left to parents based on their individual beliefs, cultural or religious traditions, and available medical information. Other organizations, such as the Canadian Pediatric Society, do not recommend routine circumcision, stating that the benefits are not significant enough to outweigh the associated risks and ethical concerns. Ultimately, the decision to circumcise or not is a personal one that should be made based on individual circumstances, cultural or religious beliefs, and discussions with healthcare professionals. It's important to gather accurate and up-to-date information, consult trusted medical sources, and consider all relevant factors before making a decision.